But for most practices who are making that transition, the time frames I like to tell them is, look, you need a couple of months to get a new practice management system up and running. Then you need to go through a billing cycle or two to be sure the cash flow and the billing things are all taken care of. Because I've seen a lot of nightmares where enough attention wasn't placed on that, and once cash flow goes in the tank, it doesn't matter what the EMR is doing. So first thing we got to do is make sure our claims are flowing, our bills, our claims are getting paid. So I tell people, work through a cycle or two on your billing, make sure that all those things are in proper order, and then you can really get focused on your EMR deployment. And it doesn't mean that some of the activities can't be going on while you're doing the PM implementation, but and the other thing I try to tell practices is to get a champion, get someone in the practice who understands the clinical workflows and the issues in the clinic, to be committed to kind of being involved in the development of the EMR templates and all the things that it'll take to be successful.
And that's a great point, because you have to really have somebody leading the way. I mean, somebody's got to be reading the map and making the decisions along the way, and then really circling up everybody else that's involved and kind of looping in their answers to questions that somebody needs to be thinking about.
Yeah, and the misconception a lot of practices have is they think that needs to be a computer person.
Right.
What I try to tell them, you got to be a clinical person that understands the back office operation of the clinic, so that they understand what workflows they can get the doctor to do and not do, and what's going to work and what's not going to work. So we try to get a champion assigned and get them to be kind of the point person working with the EMR vendors, training and implementation team to coordinate, the roll-up. So I think to answer your question, I gave you a long answer, but probably to me, in my mind, it's about a 6-month process to be effective at it. I think from the day you decide, here's where we're going and here's who we're going with,
right? I
think it's about a 6-month time. Now I will put an asterisk on that and say, since the announcement of the stimulus from the president, things have changed. I mean, there is record levels of activity going on, and all of the software vendors are dealing with bandwidth issues right now to meet the demand. So I tell people all the time, if you don't have some particular barrier that's just forcing you to wait, don't wait, because all these people, as 2010 progresses, people are going to get backed up, and I'm already seeing vendors having to give clients, dates further and further out, just because to meet and they're all ramping up training people and trying to get there. But it's just, I tell folks, be prepared to be patient. It's going to take a little while, and all the software vendors are struggling with this right now and trying to get ramped up to handle the bandwidth.
And if you look at how the stimulus is structured, if you don't begin to participate in 2011, 2012, you lose that year's money.
Yeah,
and
exactly.
So then, out of the $41,000 or $46,000, depending on how you look at it, if you miss out on 2011 money, that money's gone.
Yeah.
So if you wait until 2011, 2012, you're on a declining scale of how much you can actually participate in that stimulus package.
That's correct. So it's kind of laid out pretty well as far as what the opportunity is on the monies that are available for that. So it's kind of up to you for when you do it and at whatever point that you can demonstrate meaningful use of the EMR, which is what the guidelines call for in order for you to apply for the money. The longer you wait, the less you'll get. Now, as with most of the time with the government, they're using the typical carrot and stick mentality. The carrot's out there right now, but the stick's coming in 2015.
Stick's coming in 2015.
So, and really what a lot of practices, to be honest, are as concerned about as anything is the long-term impact of the cuts in their fee schedule if they don't do it.
Right.
So while they're excited to capitalize on the monies that are available in the stimulus plan, they're more concerned about the long-term impact of the fee schedule.
Hey, that's human nature. That's like all of us. It sounds like a good idea, but when I start having pain associated with not doing something, that's usually when I get motivated.
Yeah, very, very true in this case.